Hey everyone, and welcome to the Hormone Genius podcast. Today, Teresa and I will be talking about postpartum depression. And I know there's other names and phrases for this phenomenon that can happen after the birth of your baby. And we're going to kind of just get into the nitty gritty of this really hard topic. It's hard. It's really hard. And so if those of you listening right now have had an experience with postpartum depression, or maybe you're pregnant with your first baby and you're a little nervous about this, we hope that this podcast episode will bring a sense of healing and then also just a sense of mental preparation or things to be aware of. You know, Teresa, I know we've said this before, but even just being aware, that self-awareness is a first step in healing and in preparation of, what may come. So I personally have my own experience with this, and I have a heart for this big time. I think of most women who are pregnant right now in my life. I just imagine them being me, or me being them. Like, what do I wish I would have known before the birth of my first daughter? And so hopefully this podcast episode will serve as just a really helpful resource, and then also just a way to relate if this is something you've struggled with in the past as well. So Teresa will be also coming at this from her medical perspective. What are some things that we can do to help women in this way, and throw in some statistics and that kind of deal. So Teresa, are you ready for this one?
I'm ready. No, I'm excited and ready to do this. And I don't know about your story, Jamie, so I'm excited to hear about it and to really, because I think story is what really connects people. So that's going to be super important. But just to kind of start us off, let's just talk about the scope of postpartum depression, because we know we hear this word. And I think the word depression, of course, when you hear it, it has a lot of, we kind of have an idea of what that word is. But I think postpartum mental health is much bigger than the word depression. And many women who have postpartum symptoms, it really isn't depression they're experiencing. It can be a part of it. So it's much bigger. And I think that's why the education and awareness is so important, because I think a lot of women are wondering if they are significantly suffering from something, but they're not sure, because the symptoms they think are related to postpartum depression are not always the same for every woman. We know that women who give birth to a child have at least 50 to 80% of them will experience some sort of a postpartum blues, or, just a change in their mental health. But we also know that 10 to 20% of women will suffer significantly from some sort of a postpartum mental health change. So that's a lot of women.
Mm-hmm.
And I read something from the CDC that said that, over 400,000 women a year are treated with postpartum depression, but really only half are actually diagnosed and treated. So it's something that we're really not tackling and doing a good job of really reaching women and having them know what the symptoms are so they can reach out to their healthcare provider.
Totally.
So this is just such an important episode, and I'm so excited that we're doing it today.
Yeah, same. And something too from the CDC I learned is that 1 in 8 women, can struggle with this. And I thought that was interesting what you said about how only 50% are actually diagnosed and treated, when 30%, or did you say 10 to 20%, 20 to 30%, are struggling with this, and for right reason. And again, this episode will kind of walk through even the physiology of maybe why that is happening. And there's many factors. And I know from my own personal story, I know the factors that caused that, or partly, and it was honestly a combination of many factors that caused my, what I believe my issue. But let's kind of walk through real quick before we even dig into my story. Let's talk about maybe the difference women may feel, what's baby blues, what's postpartum depression, and also the baby blues thing doesn't also have to happen. Like, not to say it doesn't have to happen, but if it happens, it doesn't mean that you can't get help for that either, because it's not necessarily just an expected thing. So if you're feeling great and wonderful and awesome, perfect after your baby. If you're feeling baby bluesy, but you're not falling into that line of that postpartum depression or postpartum mental health issue, that doesn't mean that you don't get help. Like you still can get help and process your, whatever the case may be, the traumatic birth experience or the difficulty adjusting. So let's talk about that, Teresa, real quick. Like, how can women know the difference between just the baby blues and then actual like a postpartum depression or mental health issue?
Yeah, I think when women come home from the hospital, I mean, they've just had the most incredibly physical event that will ever happen to them in their lifetime into their body. And so we can imagine most women think it would be normal to experience fatigue.
Yeah.
And just feeling just kind of exhausted from that event. And then you've got this little tiny baby that's completely dependent on you for survival. So it's normal to just feel a little like, wow, this is a big deal. This is important. I've got to do this. I've got a lot of hard work to do, and to feel tired. And of course, a baby's up all night. So we know that sleep is incredibly affected by being in the postpartum period. And our cortisol levels and circadian rhythms are all changing. So to some degree, yes, there's going to be always some physical depletion, some exhaustion, and changes in how we feel. But when it becomes something that affects the quality of life you have, you physically in your body, it affects the way you are feeling mentally and physically. It affects the relationships that you are in, let's say with your husband, with your baby, when it affects your feelings of bonding towards your baby. Anything that's really kind of changing the quality of life for the person, that's really when it's potentially crossing over to something that should be evaluated and treated. Mm-hmm. And for us, as medical providers, of course, we can have an idea of what collection, you could say, of symptoms there are that could make up what postpartum depression is. And there are things that you would think of and maybe things that you wouldn't. For example, depression and anxiety are the two things you might think, postpartum depression, and those are common. And I would say anxiety is very common. And feeling like maybe you're wired or edgy or kind of ramped up a little bit. Maybe the cortisol is related to that. Feeling like you're either nauseous or like your appetite has changed can be a symptom. Feeling like your heart is racing or that you have feelings of panic at times. Mm-hmm. And an obsessive kind of worrying is another symptom that can happen. And it can also be strange thoughts. And this is one we don't talk about a lot, but strange thoughts are what I would say are intrusive to the body. They're things that you're wondering, why am I thinking this? And they can be very scary and they can be just weird too, but intrusive thoughts. There can also be feelings of helplessness, hopelessness, like maybe you're feeling like, I don't know if I can do this. I don't know if I'm capable to take care of this child. Mm-hmm. And there can also be feelings of either harming yourself or even harming your baby. And that's when, of course, it gets very serious. But that's kind of, you could say, the big picture of all the symptoms. Do you have to have all of them? No, frankly, you could just have one. Right. You could just be crying all the time. Yeah. It could just be one. It's just that, does that symptom really eventually affect the quality and the functionality of you in your life at home?
Right. And wouldn't you say too, like with the baby blues, it's short-lived, like you feel like it's maybe within the first couple weeks, 10 days to 2 weeks, you're feeling, that kind of fatigue and you're feeling overwhelmed, maybe trouble sleeping, that kind of deal, like an over anxiety. But then, after that, in theory, you should kind of start to stabilize a bit in regards to your thoughts and your feelings and your emotions. But with postpartum depression, I know for me, I can kind of start talking a little bit about those symptoms that I was experiencing, but like anger and rage, mm-hmm. Like these emotions, like intense emotions on the things I could not control with my child. And I'll talk about it in just a minute, but I think it went back to my birth experience and what happened directly following after my daughter was born. And then just feeling like scared of everything. I remember being at a restaurant and I had my daughter with me and she was maybe 2 months old and I was really scared. I had her in December and it took everything inside of me in February to go get out of the house. It might have even been March. I was so afraid to leave the house, so afraid because of germs and all the things. Okay. Obviously this day and age, we can be a little bit more nervous. But like 8 years ago, I was freaked out. I go to this restaurant. It's actually a coffee shop. And I order a sandwich, and I'm like, in a sandwich and soup. And I was so afraid to pick up the spoon, because I thought, if I pick up this spoon, but the person in the back who was preparing my food was sick, and then I touch my daughter, I'm going to give her something. And I wouldn't touch the spoon. I wouldn't touch anything. Like, I was so afraid, very irrational fear. So it took forever for me to get out of my house. And then I had this weird thought that I'm going to give my daughter some sort of sickness from the chef in the back who touched a spoon. I mean, just a weird kind of thing. And so it's even that, like, I'd had her 2 or 3 months prior. And it really was, for me, it was starting to kind of start peaking from personally, like around 3 months, 4 months sort of deal. And so maybe I could just start talking about that story.
Yeah, let's hear it, Jamie.
More detail. Yeah. Okay, so first baby, she's 8 now, and so excited. Wonderful pregnancy. You know, you always hear about women or people in our lives who really suffer through pregnancy, which I totally get. But this pregnancy was a dream boat. Like, I thought, this is I mean, shoot. If pregnancy is supposed to be hard, I'm having like this amazing time. Motherhood's a breeze. Yeah. Whatever, I can. So anyway, so my water broke. She was just 38 weeks. Maybe she was like 37 weeks. So we get in the hospital, and the labor takes forever. It's kind of a long story. I'm not going to go into the whole detail of it, but basically my water had a 4 sac or whatever. Like, there was another like sac that needed to be ruptured, but they just didn't realize it at the time. They amped up my Pitocin as high as it could possibly be. And I did not have an epidural because I was like refusing the epidural. Anyway, I ended up getting it, but my labor stalled way out. They would have given me a C-section if I didn't have a midwife at the time. I know that for sure. And had Emma, but I was so tired and worn out from the experience of just fear. Am I ever going to have this baby? B, what's wrong with me? Like, why can't I even contract normal? C, I had gone through natural childbirth classes, and the whole time I thought, oh my gosh, I'm such a failure. I'm getting this epidural because I ended up getting one, which, by the way, ladies, you are not a failure. You are not a failure. You can get an epidural, don't worry. And if you do, like for me, I needed it because I was so stubborn that my body wasn't resting. I couldn't nap for like 2 days. I didn't have any energy. I needed the epidural for me to progress in labor. Anywho, so I was shaming my whole experience while I was in labor with Emma. Had Emma, so tired, and so I'm there for a couple days, right? Just after your baby, you're tired, you're kind of trying to catch up. She's a sweet little thing. But we noticed that she was making a sound. And again, we're first time parents, never had a baby before. Everything is new. We don't know what normal is. And she was just making this little high squeaky noise. And we thought, yeah, that's a baby noise. And we'd ask the doctors and the nurses, hey, she's that sound, like a really high pitched noise. When she'd breathe in, oh yeah, no, she's fine, moving on with life. They checked her out and things are good. Okay. And so we take her home from the hospital, and we're doing all the first time things. And I'm on a high, like I'm excited. I just have this baby now. She's so cute and she's so sweet, and I'm learning to nurse and all the stuff. But this noise was just starting to get like kind of make my heart race every time she would make this noise. Turns out she had laryngomalacia. It's underdeveloped windpipe, so that when she would breathe in, and everyone tells you put your baby on the back, right? SIDS, all the things, all the fears. Put your baby on the back, and I get why. But for her, the underdevelopment was at the front of the windpipe. So every time she laid down, which you're supposed to lay her down on her back, she would breathe in and she'd make this really squeaky noise. And so we went into the doctor, and they said, well, she's fine. She'll grow out of it. Just don't let her cry. Just don't let her cry. Because if she cries and gets herself in a stew, that windpipe can collapse and she's going to have a hard time breathing. I'm like, oh my gosh. So the first thing we're told as new parents, try not to make her make any noise. First thing, she's making a weird noise. It makes my heart race. Number 2, don't let her make a noise. 3, put her on her back, which is when she makes all the noise. And it was driving me crazy.
Oh my gosh.
So fast forward a week, Christmas Eve, we're at my parents', an hour away. And it's midnight. I remember I just finished nursing her, and she makes that noise, and then she just stops. She doesn't release it, nothing. She just goes, and then like 10 or 15 seconds later, she breathes out. We're like, what just happened? Call the doctor. The nurse on call, they're like, you need to get to an emergency room, call an ambulance. Like, we need to get your daughter. We need to see her. I'm like, what? And she was not in any distress. She wasn't crying, nothing. She just breathed in, took a second for her to breathe out, but she made the squeaky noise. Mm-hmm. This is Christmas Eve. We go to the ER, and they do a chest x-ray on her. And they come to us with the most somber face with the result. And they say, your daughter's very sick. We need to get her to the hospital, like to Waterloo, which is where I'm from. We need to get her to the hospital you're from, an hour away. We're going to bring an ambulance in, and we're going to pick her up, and we're going to take her because there's something going on with her lungs. So this whole time, like with noise and the rules and all these things, first time. And ladies, if you've had children before, you think about when your milk is coming in and how like emotional you are with those hormones. And that's what was it was right around then. She was a week old. We go to the hospital. She's in NICU. And guess what happened, Teresa, through all this?
What?
She moved in the x-ray. She was fine. She was fine. They thought she had a terrible infection. They thought she was extremely sick. All of this rigmarole, while she did have a weakened windpipe, she was fine. She moved during the x-ray. And so when they did a second x-ray, they're like, she's good. She's going to go home.
Oh my gosh.
Take her home and you'll be fine. I'm like, what?
Oh my gosh.
It's a whole thing. And there's more to it. But main point, that was such a like pivotal moment in my motherhood. And there was something with her noise, the sound, So for those of you listening, maybe this sounds familiar, maybe it doesn't, but I think there's probably in some women a thing that happens, like one trigger. Mm-hmm. And it's crazy because even at this point, I love my daughter. She's so sweet, but it's her noises. It's things that are high pitched. It still is in me. So I have learned that you need to process that, ladies. So if there is something that you're thinking back to from your own experience 2 or 3 years ago, 5 years, whatever, and you still notice there's these interesting triggers in me to my child that are really not called for and a little unexplained. Think back to that postpartum time. Did you struggle postpartum? Was there something in particular that sticks out to you that really made you anxious? Mm-hmm. Is there some correlation? Because I really do believe like that has never, ever left me, that anxiety with noise, because my 2 younger boys can make all the noise in the world and it does not make me anxious or freaked out.
So that's a crazy story, Jamie. Yeah. And it makes me think of, so one, traumatic birth, is something that, I kind of refer to it as a PTSD for women, basically. But you almost went through, I think your birth sounded like it was somewhat stressful and maybe not overly traumatic, but to some degree, yes. Mm-hmm. But then 3 months, 4 months later, you go through a very, very strong, again, adrenaline rush, and probably just, really set off kind of that mental change right there. But it had been building also with all the little noises and things. Mm-hmm. But so when for you was it that you recognized there was a problem, I guess, in terms of how you were feeling, and did you ever get help for it?
It's a great question. I remember, doing the postpartum visits, you're taking your daughter in and you're getting checked out and all the things, and all the questions the midwife is supposed to ask, she asked. And I said basically no to all of her questions. Mm-hmm. And the reason for it is because I knew she was assessing me for postpartum depression. And I did not think that I had postpartum depression, because in my mind, postpartum depression was depression, like low mood. I was amped up to the max. Like I wasn't low, I was super high. Also, I didn't have thoughts of harming myself. I didn't harm my daughter, you know what I'm saying? That sort of thing. Although I did visualize when she made noises, like not harming her terribly, but like getting so angry at this little innocent baby, unexplained. I knew that was irrational, but I just thought I was being weird. Like I didn't know it was postpartum depression. And so, life goes on, and a few months later, I think it was probably 6 months, I go in because my husband's really noticing, like I'm being kind of a goofball. I don't want to say goofball, but I'm just not acting myself.
Yeah.
And they did prescribe me an antidepressant, which now I know that, and we'll talk a little bit about this, but my progesterone, with my second child, I was so excited to be pregnant a second time, but nervous, so deathly afraid of like having another birth experience at a postpartum time that was just. And so I did everything in my power. I encapsulated my placenta because I heard that was supposed to help. I got my progesterone shots, and ladies, I am telling you, I could tell a huge difference. This is how I knew for sure. Some people might say or think, well, it doesn't mean you have to have postpartum depression every time after you have a baby, which is true. Mm-hmm. But for my second child, I started to notice. I thought, I'm not going to need any progesterone. Like I'm doing my placental thing, whatever. I started to notice some of the same things. And so I didn't go in right away, but then I finally did get my progesterone. We'll talk about it. Huge difference. I can't even tell you, Teresa, that how different I felt. If someone would have told me, Jamie, after you have a baby, and I'm telling all of you girls this now, for those of you who are pregnant, but if someone had said, hey, having a baby is hard and you're going to be tired and you're going to feel overwhelmed, but think back to a time in your life where you felt tired and overwhelmed and think about how you were and how you acted. That is what you can expect from yourself. But if you are acting like in a way that is not typical of a tired, overwhelmed Jamie or fill in the blank person, maybe get that checked out. And so if someone had just told me you don't change as a human because you have a baby, you're still you, I think I would have been able to go in sooner and say, hey, I think I have an issue here. So that's a thing I want to say. But yeah, with some of those symptoms and things, I think so many women, hopefully, are relating to this message.
Oh, I totally, Jamie. Well, and there's also the part of, I think sometimes what holds women back is a little bit of a guilt too. Like, you prepared yourself that you're going to be a mother and that you can do this. And then it feels like you're a failure if it's not going, if you're not happy, if you're not like loving every minute, that you're a failure and you're just mad that you're not feeling the way that you want to feel as a young mother. Mm-hmm. So let's, talk about that. Again, this is real. A lot of women are going to be like, yes, I experienced something similar. But we want to get to the point where we can share with women this great news about treatments that help, and one particular treatment that's absolutely miraculous. And I've been, practicing as a nurse practitioner for 20 years. And I've often said there isn't anything in my practice that's more satisfying than treating a postpartum depression patient. Mm-hmm. And to give you a story, I remember this one was years and years ago. A young woman contacted me and she was only 19. She actually was married. She had gotten married just super young and had her first baby. And I remember talking to her on the phone and her just expressing how this was not what she expected. And she was just, crying all the time and helpless and hopeless and feeling anxious all the time and, really just out of control. Mm-hmm. And I said, it's going to be okay. And I know I have something that can help you. And, we got her set up to do a progesterone injection. And I remember calling her the next day. And this experience has now happened to me hundreds and hundreds of times, but we have a symptom checklist we'll go through, and it's all those symptoms that we talked about. And usually there's a lot of yeses. I have that. I have that. I have that. And in 24 hours, the amount of women who can change a yes to a no in the symptoms by one progesterone injection is absolutely incredible. And women, don't know about this treatment. Often women are only offered antidepressants and sometimes a lot of medications that are really hard to handle, like sleeping medications, anxiety medications that are just making you feel more fatigued and not well. But if more women knew that they could, with one injection or a certain amount of treatment of this bioidentical progesterone, they would be running for it. I know, because really no one wants to have to take antidepressant medications. They just need help.
Mm-hmm.
And antidepressants, for all of you out there who have been on them in the postpartum period, they do help. And so I don't want to discount that. And they can be very important. But I know a lot of women wouldn't have to be on them if they knew about progesterone and how it really helps women.
100%. I can't even express to everybody listening. I don't even know. I wish I could like explain this in its fullness, but I can't. But if any of us have ever experienced hopelessness, in any way, whether it's in pregnancy or any other thing, we feel like we are powerless. We are hopeless. And there's a fear when something repeats itself. And in my case, okay, pregnancy, we wanted another child, but there's this fear, like this impending doom. And you try to any and everything you can to swerve that path. Like, I don't want to go down this path again. And to know that in a matter of like a week, that I knew for sure I was going down that same path, even though my labor and delivery was a dreamboat with my second. It really was. It was the beautiful natural labor. I felt so empowered. And I thought for sure I'm not going to have issues. I'm not, because I thought for Emma, it was from the traumatic experience. But sure enough, 3 or 4 weeks in, started kind of my mental thinking and my anxiety started going south. And you're right, Teresa, like the first dose, I thought, okay, maybe I'm just having a good day. And then the second dose, I got 4 doses. You can have up to 5 of intramuscular injections of progesterone every other day over the course of 10 days. And it like healed me. I felt good. I felt healthy. I felt like myself. I didn't feel crazy. I felt like just myself with the baby. And I thought, this is what it's supposed to feel like. Do women even know that this is possible?
Right.
It's beautiful, Teresa. Thank you for what you do with that, because it impacts even that bonding even to this day, So thank you.
And
so much.
Postpartum symptoms can happen, 3 days after birth. They can happen 6 months after birth. So just know it's not like it always happens at the same time for every woman. So when it happens, it's just important to get help right away. But let's talk about progesterone and why it works, because a lot of people don't quite understand why it works or why we're giving it. And a lot of times women will be like, well, I must be low in progesterone. So you're giving me progesterone because I'm low in progesterone. Well, the truth of the matter is that when you deliver that baby, before that moment of the placenta coming out, your progesterone levels have been crazy high, because that's what's been sustaining your pregnancy for the 9 months, is very, very ample amounts of progesterone. When that placenta comes out, it goes from super, super high and it nosedives to 0 in, minutes.
Mm-hmm.
That is the natural state of being postpartum. And your progesterone levels do not rise from 0 until you go back into cycles. Mm-hmm. So you go, into this very low plateau state in your progesterone, which for some people is fine, but this is a dramatic shift in the reproductive hormones. And for some women, that change is going to create a change in their brain, a chemical change, you could say, in the neurotransmitters. And progesterone is a very calming, what we call a neurosteroid. So it actually can be anxiolytic and calming to the body. And we have progesterone receptors in our brain. The reason why it works for postpartum depression is because of that. We're not trying to treat a deficiency in progesterone, because that's the natural state of being postpartum. What we're trying to do is reverse your symptoms. And progesterone just happens to be the perfect medication, natural hormone, to reverse the symptoms. So that's how it works. And the good news is there's actually research now. There's not a lot of research, except out of the place that I work, which is the St. Paul VI Institute, on progesterone postpartum. There needs to be so much more. But in the last 2 to 3 years, there's been a medication that came out called brexanolone. And this medication is basically progesterone, or they call it alpregnolone. It's the byproduct or metabolite of progesterone. And it's given IV So a woman who is experiencing severe postpartum depression could go into the hospital and receive this medication, but basically it's progesterone. And it will reverse her symptoms by her getting like a 72-hour IV of this brexanolone. And I'm happy about this because it gives credence to the value of this medication for treating the symptoms. What's not great about it is that a woman has to go into the hospital and it's very, very expensive. And so we want women to know is you don't have to have that treatment. You can actually just get bioidentical progesterone, and the intramuscular form of it does work better because it's going to get that into the system, into the brain receptors as quickly as possible, which is why women feel so different within 24 hours of an injection. Now, do a lot of doctors know about this treatment? Unfortunately, no. It's not well known. And so there's just so much awareness and education that needs to happen to get this treatment out to more physicians. And through NAPRO technology, which is the women's health science that I have practiced, I have learned through Dr. Thomas Hilgers at the St. Paul VI Institute, and he trains doctors all over the country. Women can have access to this treatment. But outside of NAPRO technology, unfortunately, a lot of people do not know the benefits and of such a simple medication and safe in breastfeeding. Some people will wonder, do I have to stop breastfeeding, or is it going to change my milk supply? No. In fact, in some ways, it helps milk supply because it allows the body to relax to remake that milk. It's completely safe. It can actually be used with a person who's already taking an antidepressant if they found about it later. So it's just such a powerful treatment, and we really need more research to be done so more women have access to it.
Totally. I really want to drive that point home on the intramuscular injections, it being quick and fast. Because I know, of course, there's like progesterone creams and things like that. And, maybe if I was listening and I didn't have the experience or thinking about my first pregnancy and knowing that, and I don't know how effective, I can imagine it's not as effective, obviously, because you can't measure the absorption and you can't measure the rate of what you're actually bringing in, like what's called bioavailability or whatever. But anyway, but like the IMs, like the intermuscular progesterone, it's amazing. What do you have to say though, Teresa, if someone's like, well, could I try my progesterone cream? Because I honestly don't know much about that, like using that instead.
Right. Well, there's going to be some effect because it is the same hormone. It's just a different route and a different, like you said, you're not absorbing as much into the bloodstream because of the type of progesterone that it is. So I've had definitely patients who, by the time they came to us, they're like, well, I'm already using progesterone cream. It is helping, but I'm still suffering from quite a bit of depression and anxiety and other symptoms. So we know that it's just not as powerful.
Sure.
So I'm never going to tell someone, oh, you should never do that, because I do think it can help a little bit. It's just not as strong. And especially when we're talking about women who have pretty moderate to severe symptoms, it's not the answer that's going to reverse it usually.
Totally.
For our patients, we start them on the intramuscular because we know it is the most effective. We don't have to go through the gut. It's immediately in the system within hours. And patients feel dramatically better. If they're doing treatment though, and we want to kind of help them wean off of, you could say, the progesterone, sometimes we'll step down to an oral progesterone. And we know that progesterone in its oral form actually helps with sleep. And for some women, getting that sleep is like the necessary thing they absolutely need. They haven't been getting. So oral progesterone, there's a place for it and a role with postpartum depression. But like I said, if we can get those shots into the woman right away, we're going to make a person that was, really cascading and falling into a bad place and turn that around so quickly. It's just, you wouldn't want to do anything else for them.
There's so much hope, Teresa, in this avenue. There's so much hope. And what you said too about sleep, I just want to say again, or mention actually, because I forgot to say it earlier, is one other thing that I am glad someone ended up telling me with my second pregnancy, was that if like the rate of postpartum depression or postpartum mental issues drastically decreases if you at least get 6 hours of sleep. Doesn't even have to be all at once, just throughout the day. So driving home that point of, again, if you're pregnant now, or you just had your baby, or whatever the case may be, Do not underestimate sleep, and know that your sleep will be uninterrupted, or it will be interrupted, but it is okay. Don't worry, don't freak. It doesn't need to be 6 consecutive hours. But I was surprised to realize that those numbers of postpartum mental health issues skyrocket when we're not getting that sleep. So I just wanted to make sure I brought that full circle too.
Well, and it's a good point to make just on all other levels of just lifestyle too. Like hydration is important, and getting nutrition, healthy foods is
Yeah.
important. So do not be ashamed to get on that postpartum meal train.
Right.
I am someone who always believes, say yes. If anybody offers you anything,
Yes.
say yes. It's actually to the benefit of that person that you let them do something good for you. So
Right.
look at it as something altruistic you're doing for them, really. But
Totally.
let people help you. That is just so important, to not be ashamed that I think of, again, this idea that back in hundreds of years ago, we did this in community, we did this in tribes, and mothers supported mothers. And we're so much more independent now that we really need to realize that's not how our human existence, I believe, was meant to be, or at least wasn't originally. We did this in community. So let those women around you love you and support you and give you what you need. And also remember that if you've had a traumatic birth experience, that's a real thing and it does need to be processed. So counseling can be really important, because if like Jamie said in her story, if you had an expectation of how your birth was going to go, which often happens, and it went the exact opposite of how you expected it to happen, that's really traumatic for women, because we all have this idea of what our births we want them to be like. And it just oftentimes is not the experience we expected.
Yeah.
And so you need to talk. And that's why women share their stories, right? I mean,
Yeah.
what woman does not in those weeks immediately following their postpartum period want to share their entire birth story? Let women do that, because that is how they process through the happiness, the pain, the sadness, the trauma. You have to share that story. You have to relate to other women who have gone through these things and experienced the same things. So I just can't say enough about, like, you have to verbally process.
Totally. I'm so glad you said that, Teresa. And that is so true. It makes sense that that's our natural inclination, because it's how we can reflect on that experience, but also it's healthy for us. So some of the things that we can do, or you can do, or if you again have someone in your life who's pregnant and anticipating their next child, or they've had history of postpartum depression, like Teresa said, talk to someone, communicate your story. Do not be ashamed to go to the counselor. Maybe schedule your counseling appointment before you even go into labor to make sure it's in the calendar. Husbands, if you're listening to this, be on the lookout for your women, for your wives. Like, if she is not acting like herself 10 days to 2 weeks after she has her child, your child, your both of your child, both of your childs, Teresa, that's so funny. Oh, you guys know, you all know what I mean. After she has the child, please encourage her. And sometimes she's going to be resistant. Like, she's going to think she doesn't have an issue. So I don't know, Teresa, if people do this, if they call into you, like as a doctor, like a husband saying, hey, like my wife really is struggling and this is what she's experiencing. But
that has happened. Yes.
right? Like maybe
Right.
you husbands can do that. Like, call into your care provider and give them the update before your wife goes in. She will thank you later. So that's one thing. Talk to someone. Progesterone, if you are looking to find out more, naprotechnology.com, right, Teresa? They can look into that and even share that information with your care provider if they're wanting to learn more about how to support you in that way. If you're pregnant now, just come up with a plan of preparation, especially if you've struggled with postpartum depression in the past. Sleep is important. Calming oils, of course, and walking and healthy foods after pregnancy. And then also, if none of that works, there's nothing wrong with medication in these cases. But I would say Teresa and I are of the mind frame, like, go the avenue that supports and cooperates with your body first, but don't be ashamed if some of those things are not working.
Yeah. No, that's a great point. And I also just want to say it's super important to make sure, again, vitamin D is addressed because especially right now, Jamie and I were in the middle of the end of January here, and because of the current state of our culture, we're all like
Yeah.
cooped in and isolated, and we're not getting out in the sun. So if you're postpartum right now, you should be taking an extra, 2,000 IUs of vitamin D3, even if you're on a prenatal vitamin, because vitamin D deficiency causes depression. But a couple of other things I like for supplements to be helpful kind of therapies too would be Calm. It's a magnesium based powder called Calm, and that can be stirred in water. And if you just need to relax a little bit or at night just to help sleep, that's another one that's great. Fish oil is great because we know omega-3s are associated with depression if you're deficient in them. So there's a few things that, can be helpful on the side. And like Jamie mentioned, oils too, the scents again that relax us, which Jamie knows a lot more about, but I assume lavender is a beautiful scent and can be rubbed even on your feet for sleep. And I know people put it on their baby's feet to help them sleep.
Totally. And also citrus oils increase the GABA transmitters. I don't know how to explain that. The GABA neurotransmitter. Right. How do you explain that, Teresa? Like what's
It's in the pathways of the neurotransmitters that help us produce those calming, serotonin substances that calm us down to make us feel well.
Yes. So I know wild orange and bergamot, there are so many studies, you guys could look them up, but just inhaling wild orange or a citrus like bergamot would greatly benefit you in that way. So that's just another little tip. So anyway, Teresa, thanks for listening to me today. And listeners, thanks for listening to that story. It's not a story I actually share a lot of, but I would like to share more of, honestly, because I do think that, like you said, we relate to story. And there is nothing that feels more comforting than relating to another person who has struggled in a similar way and knowing that there's also hope. So I hope that Teresa and I have been able to provide some hope for those of you who are really struggling, or even, struggling from trauma years ago, to process through that. It's definitely worth it for sure, especially if you're noticing that you're triggered on things that seem not to make a ton of sense with your children at this point.
Yeah. Thank you, Jamie, for sharing your story. And I know this is going to bring a lot of hope and healing for women. So thank you.
All right. Thanks, Teresa.